Okay, welcome back everyone. It's me again. If you're watching the video version and down the bottom here for you it also says Amy Stuttle. I am not Amy Stuttle. I am a imposter. But thank you again to Victory Men's Health for having me on these podcasts. I have a few more things to say today. If you see me squirming and moving around in my chair, if you're watching the video version of this, it's not because Amy has a gun to my head making me say nice things about her clinic. I'd say that for free. I'm dealing with some sciatica at the moment. If you don't know what that is, good for you. If you do know what that is, then you know what I'm talking about. So I would like to talk about the top 3 mistakes men make when they're starting TRT. And the reason why we're doing 3 is that 4 or 6 doesn't sound as nice, and if we go for 10, I might forget what I'm talking about. Plus, I've only got about half an hour here, and I tend to ramble on for a bit too long anyway. So, without further ado, we're going to get into it. The top 3 mistakes that I think men make when they start TRT. And honestly, if you'd asked me this much earlier in my career, in year 1 or year 2, I probably would have given completely different answers. One of the many blessings I've had in my career, especially over the recent years, has been exponential growth. And with exponential growth and exponential volume of clients comes far greater recognition and analysis of trends. You can definitely see what's going on at a greater scale when you see more people. And through my work, particularly with clinics, namely my work with Primal Zone, my clinic in Australia, I've gone from seeing, 40 to 50 people over the course of the week for consultations to, in combination with my consultations in Primal Zone, maybe 200 to 300 clients a week, give or take. And this has been immensely eye-opening for a couple of reasons. When people work with me privately, it would often involve hours, many hours probably, of watching my video content, reading the stuff I have to say before booking in with me. But when I'm working client side, a lot of the time TRT only came on their radar, yesterday or last week, and they've jumped on Google, they've searched TRT clinic, and before they know it, they've uploaded their blood work and they're getting assessed for a lifelong hormone replacement therapy treatment. And they may have consumed all of 15 minutes of content on TRT, or their buddy down at the pub told them about it and how it's been great for them to put on muscle and have a unrelenting porn star level sex drive, which they have some horrifically misguided expectations about from the get-go. So that's what we're going to be talking about today. The 3 mistakes that people make, just so that you can get an idea of what the rest of this podcast is going to be about, so you don't have to skip ahead and find out. The 3 of them are not working with an exceptional clinic. This is mistake number 1. Mistake number 2 is an unrealistic set of expectations, both in terms of what those expectations are and or the timeline of achieving realistic expectations being unrealistically compressed. And number 3 is not doing the work. So we're going to go through it in order. The first point I'd like to talk about is if you would like to do hormone replacement therapy, which is essentially ongoing surgery for the rest of your life to yourself, you need to have someone exceptional do it. Would you shop for brain surgery or open heart surgery on a budget? Would you click the ad on top of Google for a $99 brain surgery? I'd hope not. And if you do, maybe you do need brain surgery. But maybe it's an IQ deficiency, not something that needs to be removed. But TRT should not be done on a budget. And I would argue that expert TRT cannot be done on a budget because of the amount of time, energy, and effort that goes into developing the appropriate expertise. 10% of medical practitioners in the world cannot do hormone replacement therapy. General practitioners don't have a clue about it, which is fine. It doesn't mean they're stupid. It just means they haven't been trained in it, which is a crying shame, but it's not their fault. And the vast majority of people who think they know how to do hormone replacement therapy, or at least market that they know how to do hormone replacement therapy, I think a bunch of them know full well they don't know, don't have the slightest of clues. They're still providing, 200 milligrams per fortnight of testosterone with your anastrozole and HCG combo pack, the fries, Coke, and the burger, and sending patients on their merry way to achieve a myriad of physical and sexual dysfunction. All surgeons use the same scalpels. I've been using that analogy for a while, and I should probably fact check myself on that, but I'm pretty sure they do. But if they don't, you get my point. Mechanics all probably use pretty similar tools, but the outcomes are not the same. And that's not what you're paying for. You're paying for the skill and you're paying for the expertise. The vast majority of patients in the US are using the same testosterone product. They're using the same syringes, they're injecting it into the same spot in their body. They're getting their labs done from the same place, and if they're taking things like thyroid and pregnenolone and DHEA and melatonin, all of these things do have some nuance in terms of what the better products are, but for by and large, most people are using 200 milligram per mil testosterone cypionate or 20% compounded transscrotal creams. Yes, there are differences in the carrier oils and there are differences in the bases, which I'll talk about in another episode. But by and large, the products are the same. So you can pay X for TRT, or you could pay Y, which is a quarter of the cost. And unfortunately, people find this out the hard way after the fact. And I'm hoping that this episode will teach people not to make this mistake that many, 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 many men have made over the years and often come to see me to fix, is that you're not going to get the same result from the cheaper clinic. You're not. If you were, I'd send you to them. Be a way better deal. Hormone replacement therapy takes an immense amount of skill. It's not easy to do. And the biggest mistake people make, we'll call this point B, is thinking that they can do it themselves. I mean, that's just mental. And it's a very unique form of ignorance that wasn't around back in my day when I started treatment almost a decade ago. For those who aren't aware, I'm not going to get too much into my backstory, but I was offered a disability pension at one point in my life, and every doctor who I spoke to said I'd never walk properly again. I believed I was going to be permanently disabled for the rest of my life. I had vertigo to the point that I couldn't walk properly for years. And as part of rehabilitating that, at one point I was working a minimum wage job in Australia in digital marketing for a not-for-profit. And I was working 3 days a week, because that was all I could handle. And then for another day, I was teaching drums to primary school kids. And this together, every hour I worked was minimum wage. This allowed me to pay for rent, pay for food, pay to put petrol in my car to drive to my job. And that's about it. Now, at this point in my life, it became clear to me that testosterone replacement therapy was something that I needed. And there wasn't a single doctor in Australia who knew what they were doing with this at this point in time. There's still very few. So at this point, I reached out to the late Dr. John Chrysler. And he was one of the only doctors in the world who was doing international-based consultations. And I believe it took me 3 full days of work to be able to afford to speak to him for 30 minutes. And I had no complaints about that, and there was no other option in my mind. Because if I was going to hijack my endocrine system with exogenous testosterone and shut my natural production down and expect to actually receive a benefit from this, I knew that I had to have the best person guiding this. Otherwise, I was probably going to end up worse off than before I started. And this is what happens day in, day out. If you want to do hormone replacement therapy, you have to do it right. You have to do it with an elite level of expertise. So do not shop for a HRT clinic on a budget. I partnered with Victory Men's Health because when I came out to see them, I was blown away within an hour, 2 hours of spending time in their clinic. Not just because of all the amazing things that they offered in the clinic. It was more of like a wellness center than anything I'd seen before. But it was abundantly clear how much professional development their staff had had. And it was across the board, and the professional development was done in the right place. You can read the wrong books, and you can waste a ton of time learning the wrong information. Unlearning that's even more tricky than learning it in the first place. But having an entire team of people who are WorldLink certified, that's the golden ticket to getting your TRT right. And one thing that I'm going to speak about in another episode, so a bit of a spoiler alert, is that 99% of TRT side effects can be solved or prevented by an expert practitioner. So if you go to the expert practitioner from the start, then you're probably going to save money long-term if it's a bit more expensive, because you're not going to have to pay the cheaper provider and then pay the more expensive provider to fix the problem the cheaper provider made, and all the pain and suffering in the process, which I think you can't put a price on, but each to their own. But you're going to have a much better experience, and you're actually going to have your expectations met. And this comes into point number 2. So point number 2 that I would like to make is that you have to have realistic expectations. My undergrad degree, before I transitioned into science, when I was learning to heal what was going on in my brain, was actually in marketing. digital marketing specifically. And one of the most important things that we learn in marketing is expectation management. And price and image and how you communicate your offering is very important in expectation management. And I'm going to be talking with my hands for a sec, but I'll try to narrate it in a way that it makes sense if you're listening to the audio version. If your expectations are here, then a positive interaction, a positive purchase without buyer's remorse means that the reality has to somewhat exceed the expectation, even if it's only by a little bit. If the reality comes in short of the expectation, even if the expectation is not realistic, then there's going to be buyer's remorse, which now my left hand is lower than my right hand, but that didn't work too well for the audio version. But I hope people understand what I'm trying to say is that the expectations, if they exceed the reality, if reality falls short of expectations, you're going to have a problem. The problem is that many people have unrealistic expectations because expectations are not objective. And this is a big problem. So one thing that's very important, and it takes two to tango. There's two parties involved here. So it is so important for providers to educate patients on this, which is why Victory have asked me to speak about this topic, because this topic is integral. Because people need to know what they're getting into. If you're going to hijack your endocrine system, you need to know what's going on. You need to have informed consent. It's very important. But on the other side of the coin, people need to use common sense. So if it's taken you 6 years of living like a degenerate and completely destroying your body with junk food, drugs, alcohol, not exercising, not going outside, that physiological state is probably not going to resolve in 6 weeks. And it's almost definitely not even going to resolve in 6 months. So the timelines that people have are often very unrealistic. And I understand why people have these unrealistic timelines. I really do. It's not that people are stupid. It's not. Because with every other drug or every other medication, if we take opioids, for example, the peak effect, subjectively and objectively, of an opioid painkiller medication kicks in when the medication reaches peak serum concentration. This is when you feel it the most. This is when it has the strongest effect. So when someone takes testosterone, it's a logical conclusion. It's wrong, but it's still a logical conclusion to go, when the testosterone reaches the peak in my blood, which is what they're measuring at the first blood test, then that's when I should be getting the peak benefits of the medication. I understand how people get to that conclusion. It's just not correct. And the reason why it's not correct is that there are kind of two categories of benefits that come from testosterone replacement therapy. One is the acute benefits. It's what you feel relatively quickly. And these benefits tend to kick in. Sometimes people get a honeymoon for a couple of weeks to a couple of months. And these benefits tend to manifest over like the first 6 months. These are a very small portion. If I had a pie graph here, this would be like maybe 10 to 20% of the benefits of TRT. The true benefits, the other 80 or so percent of this pie graph, and the benefits that are the most significant when it comes to the outcomes of TRT, are the effects of prolonged exposure to androgens. What happens when you have these levels chronic? And there's two facets I would split that off into. One is the health benefits, the effects on things like insulin sensitivity, the effects on things like energy metabolism, the effects on things like the protection of cardiovascular function, the benefits for protecting against neural degeneration. There are so many physiological benefits that occur over time. But the thing that I'm the most interested in my field, because my primary area of interest is in mental health, is who you become as a result of these chronically elevated or corrected levels of male androgens. I've been on TRT for almost a decade. And if I look back over my treatment journey, the benefits I had in the first 6 months, maybe even the first 12 months, were nothing compared to the cumulative effect of the outcomes of being on TRT for multiple years. I made different decisions. I had a much lower level of chronic stress. I was less afraid of nothing. And when I say less afraid of nothing, I used to be afraid of nothing. I had this chronic state of fear of just going outside, and ordering food made me anxious, which I think a lot of people deal with. And it's not anxiety. It's just fear. It's just fear of nothing. And it's debilitating. And when you take that away, and then you give someone almost a decade of being like, okay, now go out in the world and do stuff. If you've got a decent brain, which I like to think I have, and you've got some goals and you've got some good values and you want to leave your mark on the world, you can. Because you're not held back anymore. And I think that's really interesting. I think that's really important. And I think that that's a lot of what people are hoping to achieve. If you ask a guy and he gives you an honest answer, which is, a battle in itself, but let's say he does, and he gives you an honest answer in terms of what does he want from TRT, he probably is going to say he wants to feel more like a man. And what does that mean? I think that means leadership. I think that testosterone provides the capacity for men to become leaders, because leaders are respected. Leaders are cool, calm, and collected in stressful situations. And I think that's important for where you end up. Because generally, to live a life that's not depressing, or to break out of an environment which you've kind of built around yourself, which is a depressing life to live, you tend to have to edge outside your comfort zone over and over and over and over again to kind of push the boundary of where that comfort zone lies. And that takes some resilience. And that also takes some perseverance. It takes some delayed gratification. And it takes some long-term goal setting. That stuff, being the outcome of that, it's not physically possible for that to happen in 6 months, because you haven't had long enough to actually have your mark on changing who you are. They say that TRT takes time to work, and the former stuff, it does. But realistically, for what a lot of people actually care about, a lot of people don't care about the cardiovascular protection and the protection from dementia. That's a future problem. They don't care. They should, but they don't. They care about how they're going to feel. They care about who they are. They care about the respect they're going to have when they walk into a room. They care about the respect they're going to have from their wife and their family. That stuff's like the day-to-day stuff that's real. And jabbing testosterone into your delt doesn't do that. I wish it did. It would make my life easier. It would make my job a hell of a lot easier. It doesn't. But what does do that is the outcomes of who you can become when you've had corrected androgen levels, because hypogonadal men can't get very far, especially if they've been hypogonadal in the early 20s and early 30s, because that's when you're still building who you are. So that's a really important point. And the segue from that, I guess the point 2B, I'm really going to use my 30-minute limit today. The point 2B that I would like to make is that you have to have realistic expectations for what TRT is. TRT is not a 2 gram a week steroid cycle. It is not going to give you the libido and sex drive that you had when you were 17, 18 years old, when you had no responsibilities and you'd first discovered what sex was. It's not going to give you a porn star functioning penis where you will be erect at the drop of a hat every single moment that sex possibly arises as an opportunity. You're probably not going to wake up every single morning with an erection. And you're also not going to wake up every morning at 5 a.m. just itching and absolutely driven to hit the gym. That's not TRT. Wish it was. It's not. That's more the kind of thing that you get from recreational drugs, which are not good for you, because what goes up must come down. What TRT does do is it makes you feel the way you're supposed to feel. That's it. There's nothing more, but there's also nothing less. So you're going to get the results you deserve. And that's important, because anything beyond that is an entitlement mentality. And that's not a good thing to have. So you have to be realistic with what this is actually going to do for you. And you have to be realistic with how long it's going to take. It's going to give you the results that you deserve. And I like to look at puberty as a timeline, which I think is reminiscent. Give it years. Give it 2, 3, 4, 5 years. That's what we're looking for. But it's not going to flatline you until then. It's going to be a gradual incline in how you're feeling and how you're doing. And this segues into point 3. The thing that's going to impact how far you get on that trajectory or what's going to make it a relatively low gradient linear increase or an exponential increase is going to be the work that you put in. And it's going to be what you actually do day to day, week to week, what your daily habits are, what you're doing 24/7, 365. This is really important. And this comes into the point 3 that I wanted to make, which is that when you're on TRT, you actually have to show up and do the work. And this is one of the biggest mistakes people make because they have this unrealistic expectation. I've spoken to so many men who honestly believe, and they've already started TRT, so this can be like a bursting of the bubble. They go, oh, well, because my testosterone's coming in externally, and I don't have to make it myself, I don't have to look after myself anymore because my testosterone's covered. You know, I can stay out late, I can drink, I can do some drugs on the weekend, I can have a few extra cheat meals, I don't have to train as hard because I'm getting my testosterone for free. If all of this stuff worked like this, it would be great. It doesn't. And if anything, it's actually the opposite. And if that was your expectation coming in and then you learn what I'm about to teach you, that can be a bit of a slap in the face. But welcome to reality. TRT doesn't work like that. The problem with TRT, I'm not going to say the problem with TRT, the limitation of TRT, the realistic part of TRT is that if you don't look after yourself properly, you're going to get side effects. This is a problem. The problem goes further when people don't recognize this. And they go, well, every single one of these problems that I'm having on TRT can be solved with the right protocol. So it means that if I'm having these issues, I just need to change my dose. I need to up my dose. I need to drop my dose. I need to increase my frequency. I need to change to cream. I need to add in an aromatase inhibitor. I need to add in HCG. I need to change my dose of my aromatase inhibitor. I need to change the type of aromatase inhibitor I'm using. I need to use more HCG. I need to use less HCG. You need to stop drinking beers every night. You need to cook healthy food. You need to exercise. And you need to probably drop 30 to 40 pounds of fat. This can be a difficult pill to swallow, but this is the truth. And the problem is, and this is the point that I want to make in point number 3, is that one of the biggest mistakes people make is they don't realize that they actually need to live a healthy diet and lifestyle to not have side effects on TRT. And they need to do this consistently for. So when we look at what testosterone replacement therapy is we are giving you the healthy testosterone levels that you should have at your age in order to feel your best. And we call this a physiological amount of testosterone. So, you know, taking a steroid cycle would be a supraphysiological amount. So we're giving you the upper physiological amount so that you feel your best. Because these are the levels that a healthy man should be making. What if you're not a healthy man? Then you're going to have some side effects. And this is the problem. And the lack of education on this for both providers and patients is causing a huge amount of issues. Because on one hand, providers aren't aware that they have to educate their patients about this. But on the other hand, people aren't aware that if they don't live healthfully, if they don't live in a way that they would be making these levels naturally, if their body was working properly, then they're going to get side effects. The distance, the gap between the level of testosterone that someone is taking and the level of testosterone that they realistically would be making based on their inputs and outputs, the gap between that causes side effects. That's how it works. It's that simple. Solving it's not simple because you have to change how you live. That's difficult. TRT protocols are not rocket science. Injecting 3 times a week instead of twice a week, getting the dose right, not taking breast cancer medication, that stuff's not that difficult. What is difficult is people setting the alarm in the morning and actually getting up when it goes off every day and then going and exercising when they haven't been. What's difficult is people cooking meals on the weekend to eat throughout the week that are healthy and nutritious rather than hyper-palatable junk crap that they're ordering from Uber Eats. That's a difficult habit to break, especially if you suck at cooking. That stuff's hard. It's really hard. And that's the stuff that is make or break, unfortunately, for when you get to your 12-week review or your 6-month review or your 12-month review, in terms of how well you're doing. It's how did those things go? Did you stick to the plan? Or did you deviate from it? Or did you completely disregard the importance of it? And every single person I've met who swore to me black and blue that they needed an aromatase inhibitor was either drinking alcohol excessively or were overweight. Every single one. No exaggeration. Absolutely no exaggeration. Every single one. Every single person who I have met who swore to me that they were a genetic over-aromatizer was overweight or drinking alcohol regularly. Every single one, without exception. There were no exceptions to the rule. I always say that exceptions don't disprove rules. There were no exceptions to these rules. Every time. So when you start TRT, you are responsible, assuming the first two variables were in place. You had a good provider who put you on a decent protocol to begin with. And then you have realistic expectations. You are the variable that is going to determine whether those expectations are met at the 3-month, 6-month, and 12-month mark. It is your responsibility. Your provider's responsibility is just kind of putting the protocol together for you and guiding you. You're responsible for execution. And I would argue that you have the majority of the responsibility here because you're the one who has to manage yourself every single day. And generally, the stuff that you need to do and the stuff that you want to do, especially if you've been on track for a while, are two very different things. And this is difficult. Breaking habits is difficult. Being consistent is difficult. But I'll tell you what else is difficult. Feeling like crap. Even when you've already pulled the trigger on TRT, you've done the thing that was supposed to make you feel better and you still feel like junk. And it's because you actually have to live a healthful lifestyle. It took me years to work this out. And it's taken other guys years to work it out. So if you can listen to this and be guided before you start the treatment to go, okay, I need to get an expert provider. I need to have realistic expectations of what this timeline is going to look like. And then I need to look after myself properly. And I need to live in a way that I would be making these levels naturally if I could, even if it takes me some time to work on myself, to drop the body fat and to change the habits and to change the nutrition and to increase the exercise. Even if that's something that is a gradual change and takes time, that's okay because TRT takes time to work as well. So if you get those three things right, you'll set yourself up for success. If you don't, you'll set yourself up for failure. And that's just the way it is. So hope that helped, and I'll see you guys next time.